Chapter 28 discusses self-management in regards to, how do you manage your stress and how do you manage your time efficiently, no matter what role you are in the nursing profession or healthcare profession. So here are the objectives. In this PowerPoint, we are going to discuss stress management, time management, and how do we manage a meeting. Stress. What is stress? Stress is a continuum ranging from you feel good to your distress. The key is not to reach either extreme. Stress has been defined as a gap between how we would like our life to be and how it actually is. So what are some sources of stress? Some sources of stress can be external, change. When we think about change, because we are frontline direct care nurses, nurse managers, and chief nursing executives alike cannot easily balance caring for the patient and clinical expectations with business and administrative demands. It is completely normal sometimes to experience a considerable role overload, frustration, and distress. When we talk about social factors, things to think about there that might lead to stress are changes in our healthcare delivery system, as well as the cycles in nursing workforce supply and demand have impacted professional nursing in many ways. Some of us maybe work in a situation where we have a lot of Gen Xers, or perhaps we have a large percentage of older nurses. In situations where values of one generation of workers clash with that of another, conflict occurs unless a manager becomes aware of how to best maximize the positive behaviors from each generation. Another social reaction or stress is shortage of staff. Inpatients may have minimally safe levels of professional caregivers, and this can lead to stress. So that's just some ideas of social stress. When we talk about positions and roles, one thing is technology. Technology can either, the lack of technology frustrate us in the workplace, or the presence of the technology. Often nurses face stress as they attempt to learn and integrate multiple systems that lack the sufficient interface. So you might work somewhere where you have charting that you've learned on the floor, but if you go to ER and work, the charting system is completely different, and that becomes stressful. Role stress for new graduates is related to role overload. They learn the NCLEX role, and then we drop them out into reality, and there is a conflict between what they learned in the classroom and the actual practice. It increases stress, and this concept has been historically common in nursing, that the phenomenon gave turn to we'll call it reality shock. Gender roles, this is an interesting fact, approximately 9.4% of the nation's 3.1 million licensed registered nurses working in the United States are men, and so most nurses are women, and they go home at the end of their shift to their traditional responsibilities, including managing the household, caring for young children, and aging parents with health care demands of their own, and that adds to your stressful workday. If we talk about internal sources of stress, that's personal stress triggers for you. So maybe a death of a loved one, losing a job, getting married, getting divorced, poor unhealthy lifestyle choices such as caffeine, lack of exercise, a fat-ridden diet, inadequate sleep time, inadequate time for yourself for leisure activities. When we talk about dynamics of stress may result from unrealistic or conflicting expectations that we have for ourselves. And so we just want to make sure that we don't set our expectations too high and demand too much of ourselves when we can't meet those demands. Signs of stress. There are many issues that result from stress. We can have accidents, poor physical and emotional health, turnover, absenteeism. Some more subtle signs of stress include headache, fatigue, apathy, disruptive behaviors. Remember that not every headache is due to stress, and feeling tired is a logical result of working hard. Yet both of these can be subtle signs of stress, and also when you or a coworker repeatedly say, "I don't care," you decide unless a decision is seriously consequential, this may be a sign of stress too. You've just kind of given up. So how do we manage stress? How do we prevent? And that's really where we want to be, is prevention. Remember that we work in an unpredictable, uncontrollable change. Changes happening every day on the shift where you are working, and coupled with immense responsibility and little control over your work environment, sometimes nurses develop anxiety, depression, headache, they start smoking, and a common source of stress is just unrealistic expectations. So we really do, as nurses and as professionals, need to work to reduce stress. Some things that we can do is daily meditation. There are actually apps that you can download that will help you do daily meditation. Support in the form of positive work relationships may buffer stress. It's beneficial too to have an active membership in a professional organization. It's a lifelong source of enthusiastic colleagues who are passionate about their nursing career. And remember that stress applies to all nursing situations. We'll talk about burnout on the next slide. So burnout, what is burnout? Burnout is not an objective phenomenon. It's a perception of stressors, and they are mediated, and a level of adaptation by the individual are important. It's a phenomenon in which cumulative effects of a stressful work environment gradually overwhelm the defenses of the staff members, forcing them to withdraw psychologically. So what are characteristics of burnout? It's physical and mental exhaustion, emotional exhaustion. You become cynical, you depersonalize, you start having physical complaints. Prevention is the key, and it starts with choosing the right workplace. If you've had a bad experience during a clinical situation, you don't need to decide to work there to overcome this experience. Move on, figure out what the daily stressors are, and try to space them out, avoid them, find new ways to respond to them. And don't forget that physical stress that is just as damaging as psychological stress. Insist on equipment in the workplace that helps you do the work in a correct and timely manner and prevents injury. Again, what are some resolutions of stress? We need social support. We need to be involved in professional organizations. We need mentorship, to share ideas of what they do to reduce their stress. We need to go to conferences to get re-energized. All of this is important for leadership and management. So time management skills are important to help reduce our stress. If we think of calendar management in a broad sense, it really refers to managing the time we have in life to achieve what we want. And whether we are discussing a calendar, a schedule, or hours or minutes, the key is that time easily escapes us. And we must ask ourselves these questions. Are we doing too much? Are we able to say no or not yet? Do you procrastinate? Do you spend time complaining versus really acting on it? Are you a perfectionist? Are you organized? Do you have a minute? Do you allow interruptions? And remember that everybody that everyone has only 24 hours a day to live life, and successful people know how to use that time effectively for themselves, their careers, their loved ones, and their work. So how do we control interruptions? Being organized doesn't prevent interruptions, but they often can be accommodated or minimized. If you aren't organized, the smallest interruption can become disaster. Be sure to use delegation, which we're going to talk about on the next slide, to maximize your effectiveness. Know what needs to be reported back, and be clear at the outset of how you will keep apprised of changes in patient status. Multiple things happen at once in clinical settings, so setting priorities and focusing on those keep you goal-oriented. Whether you use electronic device or a piece of paper, use some kind of method of tracking your own time. Sometimes when we are immersed in a situation, we lose track of time and then aren't sure what we need to do next. If someone wants to give you information, unless it is in response to a question you ask them to write it down and give it to you. When we become really busy, we may forget information that wasn't related to the situation at hand. So that's a good strategy to use. Time management. We need to here. I'll let you read this slide, but here's some other things to think about. Schedule meetings right before lunch or at the end of the day. This encourages participants to stay on task. No meeting should be longer than 2 hours. Avoid interruptions in meetings. So make sure that you have an appropriate seating. So don't sit people who are friends by each other because they're going to whisper. Someone who maybe handles a lot of emergencies in the facility, they need to sit by the door so that they can easily slip away and address those. Distribute agendas. Keep the meeting on track by using Robert's Rules of Order to keep structure to the meeting. And a good leader knows how to delegate. You need to use appropriate delegation. Be willing to give and accept delegation. Give whoever you delegate to, give them sufficient responsibility and authority. Convey your expectations clearly. Require them to be accountable. And then have them debrief back to you. What worked, what didn't, what will you both try to do differently next time? But to survive in this busy healthcare world, you have to be able to delegate.